This week on the Bronson Health Chat, a discussion on care at our hospitals during this time of COVID-19. Our Bronson Health Chat with a reminder that if you do need care, even though hospitals have been dealing with the COVID-19 virus, it is still safe to go to Bronson facilities if you need treatment, because they have many protocols in place to keep you safe. Joining us for our Bronson Health Chat this morning, Dr. Scott Gibson, an emergency medicine physician and member of the Bronson Medical Staff Leadership. Dr. Gibson, good morning.
Good morning. How are you, Ken?
I'm doing very well. Hope you are as well.
I am. Thank you.
Great. Thank you for joining us. Now, are you still seeing patients coming into the emergency department other than individuals who are worried about whether they have symptoms of COVID-19?
We absolutely are. In fact, the numbers of COVID-19, although somewhat steady, are probably a little lower, and the majority of patients that we see are for other reasons. But we've been a little concerned as this pandemic has sort of moved forward, in that the community, I think, probably should pat itself on the back for its good work in flattening the curve. And whereas we sort of expected this big surge of patients, we did have a peak, but we've actually seen our numbers go down in a lot of visits, especially in the emergency department. And that has us worried that people are not seeking care for conditions that really should be seen, and it could cause some problems downstream.
Well, the question in many minds, is it safe for patients to come to the hospital at this time?
I would say absolutely yes. There's no zero risk in life, and but hospitals kind of have this game down, right? Even before COVID, hospitals were extremely efficient and very good at sterilization and infection control processes. So whereas, again, we were expecting this big wave that some larger metropolitan areas saw, so we wanted the community to be careful about coming during that initial phase. They did a good job of that, and now that that initial phase has passed, we do want to make sure that the public understands that we have many procedures in place, including the normal things, and then even stepping up the game during this pandemic. We have separate waiting areas, and we like to think that at most times people don't have to wait, and especially depending on what they present for. And then on top of it, patients that we do have a suspicion for infectious illnesses or COVID disease, that they can be separated and isolated from the rest of the public. It's a little uncomfortable because the protective gear that we have to wear sort of dehumanizes things a little bit, but it does protect both ourselves, the community, and the patients individually.
Dr. Scott Gibson from Bronson with us on our Bronson Health Chat this morning. Doctor, why is it important for patients to get care and not wait until the pandemic is over?
Well, we worry that some unchecked health conditions could go on and become worse. There are surveys going on around the country right now that have shown that is, in essence, what has happened. Our drop in visits has been pretty similar to other healthcare systems. And so when people have chest pain and it turns out to be from a heart cause, that can lead to more complications down the line. If somebody has an unusual numbness or speech problems that turns out to be from a stroke and that doesn't get addressed, then we can wind up with more problems in the long term. And then the same thing goes with chronic conditions, things like diabetes and hypertension, and things that go unchecked and aren't answered really are problematic.
What should patients do if they have questions, doctor?
Probably the most important thing is to check with your primary care provider. If you don't have a primary care provider, Bronson has several access points, including Bronson Care Advisors, and the emergency department at all of our hospitals are open 24/7, 365 days a year, and we're happy to take care of anyone who has a concern that they think needs to be addressed on urgent basis.
All right. Anything else you'd like to share with us on this topic this morning?
No, I appreciate you giving us a chance to discuss these issues. We really want to make sure the public is aware that we exist. These numbers are actually small, and it's safe and much in their interest to come and seek the care they need.
Dr. Scott Gibson has been with us, an emergency medicine physician and member of the Bronson Medical Staff Leadership. And we thank you for your time joining us this morning and sharing this important information with everyone.
Well, thank you very much. I really appreciate it.
Appreciate your time on News Radio 590 and 106.9 FM WKZO.